Which was the special display?
Audio test 1 2 1 2. This is WHO shock room in Geneva. 1 2 1 2. Ready for our 2019 coronavirus press conference. 1 2 test 1 2. We'll be a couple of minutes away. NCOV.
So, I mean, obviously, you have GAs. You would try to lean on me. I was telling you that. I think you can do that. I did the right person. And I haven't known this. We are. The room sound up. And in fact, never. It's honest man on the face of it. It's just
Good question. If you can pull out the chair from this side.
We can have a chair here,
Can you just
on this side, on that corner.
Excellent, Chief. Good afternoon, everyone. Thank you very much for joining for another regular daily press conference regarding novel coronavirus from WHO headquarters here in Geneva. Welcome to all journalists present here in the room. I see some new faces. Welcome to WHO. Welcome to journalists who are joining us either online or through phone line. And welcome to everyone watching us on WHO Twitter account. Today with us we have Dr. Tedros, WHO Director General, Dr. Mike Ryan, Executive Director of WHO Health Emergency Program, and Dr. Sylvie Briand, Director for Global Infectious Hazard Preparedness here at WHO. Before I give the floor to Dr. Tedros, we are using the same system as we used on Saturday. It means those who are watching us online, journalists online through Zoom, if you want to ask a question, please click on the raise hand on the right-hand side of your screen. And those who dialed in through phone line, please type *9 on your keypad and you will be put in the queue for questions. As always, we will have an audio file and transcript from this press briefing. Dr. Tedros, please.
Thank you, Tariq. Good afternoon. As usual, I will start with the latest numbers of coronavirus. As of 6 a.m. Geneva time today, there were 40,235 confirmed cases in China and 909 deaths. Outside China, there are 319 cases in 24 countries and 1 death. The overall pattern has not changed. 99% of the reported cases are in China, and most cases are mild. About 2% of cases are fatal, which of course is still too many. A lot of people are asking, where is the outbreak going? Is it getting better? Is it getting worse? We're doing several things to answer those questions. First, the meeting on research and innovation starting tomorrow will identify some of those questions and chart a path forward. Second, an advanced team of WHO experts has just arrived in China, led by Dr. Bruce Aylward, to lay the groundwork for the larger international team. Bruce and his colleagues will be working with their Chinese counterparts to make sure we have the right expertise on the team to answer the right questions. We're grateful for the many people who have volunteered their expertise from all over the world. In recent days, we have seen some concerning instances of onward transmission from people with no travel history to China, like the cases reported in France yesterday and the United Kingdom today. The detection of this small number of cases could be the spark that becomes a bigger fire. But for now, it's only a spark. Our objective remains containment. We call on all countries to use the window of opportunity we have to prevent a bigger fire. As part of those preparations, WHO is working to equip laboratories with the capacity to rapidly diagnose cases. Without vital diagnostic capacity, countries are in the dark as to how far and wide the virus has spread and who has coronavirus or another disease with similar symptoms. We have now identified 168 labs around the world with the right technology to diagnose coronavirus. We have sent kits to Cameroon, Cote d'Ivoire, DRC, Egypt, Ethiopia, Gabon, Ghana, Iran, Kenya, Morocco, Nigeria, Tunisia, Uganda, and Zambia. Many of those countries have already started using them. Another shipment of 150,000 tests is being assembled in Berlin today and is destined for more than 80 labs in all regions globally. Last week, the African CDC conducted training in Senegal with 12 countries using tests sent by WHO, and further training will take place in South Africa next week. WHO will continue working with all countries to prevent and detect rapidly new cases of coronavirus and to save lives. I thank you.
Thank you very much, Dr. Tedros. So we will start immediately with questions. As always, we will start here in a room and then we will go to our colleagues online. Please, one question per journalist so we can try to take as many as possible. To Mark and Gabriela, please.
Yes, I have a question.
If you can just take a microphone. Sorry, just here. We have a rowing mic for today. Thank you.
Hi. Hi, this is Liu from China's Xinhua News Agency. Two questions. Sorry. One question. Okay. Does WHO has any comments on the reports, the latest reports that there is a breakthrough in research about the virus? That researchers in South Australia, the New South Wales, I guess, they have successfully managed to obtain live virus from the patients instead of synthesize the samples. Does that help in any way to quickly detect the virus and diagnosis, judging from the WHO's point of view? Thank you.
They have synthesized the virus? I didn't understand. Question. Can you repeat just the question, please?
Yes, there are latest reports from the Australian health authorities from New South Wales. The researchers have successfully managed to obtain a live coronavirus from infected patients instead of synthesize the samples from laboratory. Does WHO know that or had any comments on that?
Okay.
I think a number of labs have isolated the virus now around the world, so I think, and are actively sharing the virus as well. So it's really important that we have multiple isolations. The sequencing of the virus is very important and allows us to track the sequence, but being able to isolate the virus itself provides the basis for both therapeutic and vaccine development, as well as the development of diagnostic assays, particularly serology, which we need right now. And having live virus is very important for developing the neutralizing tests and other things we need to test for the presence of the antibodies to the virus, which will allow us to look at population attack rates, not just look at who's been infected and who's been sick, but to potentially look at a broader proportion of the population to see if there are milder cases out there that we're not detecting. So live isolation of the virus allows a huge advance in diagnostics and potential advances in therapeutics and vaccine development. But the virus has been isolated for a good while now, and many labs have done that.
The viral culture of the virus in laboratories is indeed a next step. I mean, to the normal diagnostic, which is based on PCR, and it's indeed very important because when you have, for example, the genetic sequence, is like having the ID card of the virus, but not the virus itself. So here, with having the virus in hand, it's indeed much better to make testing and to make probes against therapeutics or vaccines.
Thank you. Mark, please.
Yeah, Mark Webster, CDTN. Could you give us an idea of what the priorities are for your team on the ground now in China? And are you satisfied that they will get full cooperation from the authorities there?
Yeah. The team is there first and foremost to learn and to understand not only the investigations that have been carried out so far in China, but also to understand the nature of what has been one of the largest public health responses in history in China. So we both learn more about the virus, to learn more about the investigations that have been carried out by Chinese scientists and epidemiologists, to understand the nature of the public health response, which reaches right from the lowest level in the community right the way through the system to the top. So there are huge lessons to be learned from that experience. But immediately, obviously, understanding better issues around the origin, source of the virus, issues around severity of the disease, answering all of those questions. And we believe that many of the ongoing investigations, which are actually being implemented by Chinese scientists, are getting those answers. We will be able to, by sending very senior, eminent people, create a collaboration and exchange of ideas that will allow those investigations to be even better. But I think primarily and first and foremost it must be seen that this is an investigation to learn and support China. But also many of those scientists have been collaborating externally and internally. Many of these people actually know each other already. This is not a voyage into the dark. This is going to reconnect with scientists that we're already working with on a day-to-day basis over many, many years. So this is about increasing the levels of cooperation, not establishing cooperation.
Thank you very much. Gabriela, you had a question?
Yes. Sure. Thank you.
No, please use that microphone over there.
Sorry, Gabriela.
Thank you very much. Gabriela Sotomayor, Mexico. I have a question on the forum that will begin here at WHO tomorrow, the experts. Are you inviting experts from Taiwan to be here in Geneva? Because you know that China said that they invited experts to Wuhan, to the epicenter of the outbreak, but they had limited access. They weren't allowed to go to the market, for example. So I'm wondering that, considering that Taiwan's geographical proximity and frequent people-to-people exchange with China, they have so far 17 cases. So they have different health systems, and my question is, maybe they have something to share with the international community. So are they going to be physically here in Geneva? Are you inviting them? Thank you.
We will have a number of Taiwanese colleagues online as the conference is greatly oversubscribed. In fact, there's a huge number of people dialing in, and mainly a lot of those people dialing in are people who are in the front line themselves. So we have to be very careful in bringing scientists together that we don't disrupt the response itself. So a lot of colleagues from around the world are both coming in by WebEx, by telephone, and will be online for the deliberations. In addition to that, we've, as I said in previous teleconferences, have been engaging with technical colleagues on the Taiwanese side for over the whole course of this event, including following up on probable cases in Europe, multiple teleconferences, and we continue to engage Taiwanese colleagues and colleagues on the Chinese mainland in all aspects of technical cooperation in order to better understand this disease.
Thank you very much. Let's move online for a few colleagues who are dialing in. CNBC, can we hear you? Can you introduce yourself, please?
Hi, yes, thank you for taking my question. This is Dawn Kopecki. My question is regarding the mortality rate and the time frame with which it takes this virus to be lethal enough for someone to die from it. It's 2 weeks from transmission to symptoms in many cases, and then how long does it take? Some doctors here are saying that the disease kills people at a slower rate or a slower pace than SARS, but they're not sure that the mortality rate that we're seeing now is the mortality rate we'll be dealing with in 3, 4, 5 months. So can you talk about how long it takes for someone to get sick enough to die from this, and then what that says about the mortality rates we're seeing now and what we might see in 3 or 4 months?
Thank you very much for that question. Let's see if you can take it.
So I think what we have now is a better view of how many people are have mild disease. It's around 80%. How many people are of a severe disease, mostly a pneumonia that requires hospitalization. From the latest data, it's around 15%, and also it's around 3 to 4% of people who will need 3 to 5% of people will need intensive care. So what will make a difference in terms of mortality is really the underlying condition of the patient. And if this patient will have a very critical illness or not. And this is why people who are transferred to intensive care units may stay much longer in the hospital, because they have they can receive a very sophisticated care, and therefore it takes some time longer for them not only to recover from this very severe disease, but after ICU, when they are transferred to normal ward, then they need more time to recover as well. So the range of hospitalization may vary a lot depending on the status of the patient and their age and their underlying conditions. When you compare with SARS, we have also to recognize that since SARS, the medicine has done a lot of progress. We have now new technologies such as ECMO that allow also to save more severe patients, and so these technology are really important as well to explain why people may stay longer in a hospital, because they are benefiting from much better care than maybe what we could afford 2 decades ago.
I think it's important in reflecting on that the health system in China is sophisticated and is capable of delivering high levels of intensive care. And when you consider that 90 to 100% of patients in hospital require supplemental oxygen, 20 to 25% of those patients require intensive care, and 5 to 10% of patients may require some form of mechanical ventilation. That's a huge demand on a system. That much, so it's a tremendous achievement that so many patients can be kept alive. But there is a lag, and some of those patients will die, and that's a very unfortunate thing. But again, reflecting on what the Director General has said many times before, imagine this disease establishing itself within a weaker health system, without those capacities, without those capabilities, and that's what we've been calling for. This disease may appear relatively mild in the context of a sophisticated health system. That may not be the case should this disease reach a system that is not as capable as that of China.
Thank you very much. Let's take one more from online. We have someone from Montreal in Canada. Can you hear us? Can you introduce yourself?
Yes, good morning. My name is Jean-Benoit Legault. I am with the Canadian Press in Montreal, Canada. If possible, I would like to ask Dr. Briand a question in French. Dr. Briand, j'aurais aimé obtenir des précisions concernant la situation à bord du navire de croisière qui est en quarantaine au large du Japon. Est-ce que vous pourriez m'expliquer comment la quarantaine est appliquée dans une situation comme celle-là? Est-ce qu'on recommence à zéro à chaque fois qu'une nouvelle infection est détectée? Comment c'est géré ce genre de situation-là habituellement?
Translate this for everyone. So it's a question about quarantine rules for people on board of a cruise ship. Are we starting always the new quarantine period every time the new infection is being detected? Dr. Briand?
Oui, merci pour cette question. Alors, en fait, ce qui se passe à bord de ce bateau, le Diamond Princess, c'est effectivement que quand les cas ont été diagnostiqués parmi les passagers, les personnes qui étaient positives lors du test ont donc été évacuées et hospitalisées sur le continent. Donc, ne sont pas restées à bord. Par contre, les autres personnes qui sont restées à bord du bateau, on leur a demandé donc de rester le plus possible dans leur chambre, dans leur cabine, et s'ils devaient sortir de leur cabine, se munir de masques. Et donc, les tests sont faits régulièrement sur ces personnes. Donc, normalement, la période de quarantaine devrait se terminer le 19 février, mais on est en train de travailler avec les autorités sanitaires et aussi les personnels qui sont en train de réaliser l'investigation sur le bateau pour voir comment on pourrait aller de l'avant en termes de quarantaine pour à la fois respecter le droit des personnes et leur permettre de pouvoir circuler librement et en même temps s'assurer que le risque de transmission est vraiment minimal, voire inexistant. Donc c'est actuellement les interactions qu'on a avec les autorités sanitaires pour trouver la meilleure mesure possible.
C'est juste aussi pour préciser, quand il y a des nouveaux cas, c'est juste les contacts de ces nouveaux cas qui commencent encore les 14 jours. Okay? So, c'est pas tout le bateau, c'est quand il y a des autres cas, c'est juste les contacts précoces de ces cas qui commencent encore les 14 journées.
Very quick one in English for rest of the journalists.
So currently, so what happens is that the people who were found positive have been hospitalized, so they are not anymore on the ship, and the people who have been contact, I mean the rest of the travelers are checked regularly, and so when a new case is found on the ship, then only the close contact of this person are considered for additional quarantine, but otherwise quarantine for the rest of the travelers is supposed to end on 19 February.
Thank you very much for this translation. We'll go back to the room, start with Jamie, then we have Shane, and then one more here. Jamie, can you just please grab that
Down off the stage.
France and how concerned are you that we may be seeing a super spreader emerge? What exactly is that, and what could that how could that be defeated? And then just on a similar note, sorry, it's the same thought, Tarek, is that there are conferences that are happening all over the world. How concerned are you, including one that's going to happen here tomorrow, how concerned are you that conferences may be a place where super spreaders could emerge from? Thank you.
Thank you, Jamie. If we can just get a microphone toward this area.
Yeah. On the event in Singapore, no, I think it's way too early and much more of an exaggeration to consider the Singapore conference event a super spreading event. The events Singapore at the moment, I think, has about 40 confirmed cases, 21 associated with import from China, 19 locally acquired with no history of transport. The Singapore conference cluster has 12 cases associated with it. Those 5 you mentioned, Jimmy, in Singapore, or in France, the 3 in Singapore itself, and then Korea, Malaysia, and the United Kingdom. But those numbers are ones. So we're not dealing here with the super spreading event, people comparing it to the Amoy Gardens or to the Metropole Hotel or any of that. But certainly it is always a concern when people come together and then move apart, and we have to have risk management procedures associated with that. But you can't shut down the world either. Normal activity must go on. So what we need to see is reasonable well-managed meetings and gatherings in which the risks are managed appropriately. We're not going to be in a position to say on the slightest possibility that there may be possibly an infection associated with nCoV that we're going to cancel every event. Otherwise, we cancel these press conferences and we won't be able to speak to you. So where is the limit to this? So I think we need to remain calm. We need to be measured. We need to be driven by risks. First, we need to identify those risks and look at those events one by one and say, okay, what are the risks? How can those risks be minimized? There is no zero risk in anything in life. You may trip on the stairs going out of here. It's a risk. So I think we need to take a risk management approach, accept there's no zero risk, and do our best to ensure that we ensure the safety of people attending all gatherings around the world.
And I think also what is very important is to talk about super spreading event and not people. Because it's not the person, it's really the circumstances and the situation that makes the transmission increase, and not the people themselves, so that we avoid also some stigmatization that is really unnecessary. Thank you.
Thank you very much. We had one question here. If you can just please give the mic, and then we will have it. We will try. If you have short one question, we will be able to get to everyone. Thank you.
Hi, my name is Ken. I'm from the Japanese newspaper Yomiuri. I'd like to come back to the international expert team. Can you elaborate a little bit more about their time frame of work and how many people are there for the advanced team? Where are they working? I assume it's Beijing, but you haven't mentioned it. And how many people are you expecting for the team altogether?
The advanced team is already there, and they will prepare everything for the rest of the team. And we hope the rest of the team will join them as soon as possible. And the team could range between 10 and 15. But we're aiming for 10, actually, to make it as manageable as possible. So if need be, we can increase, but it will be around 10. So that means additional 7.
And where are they working?
Of course, they will have a plan.
No. Where?
They will have a plan. They will organize a plan based on the discussion with their counterparts. What to visit, when to visit, and where to visit, and where to focus, what kind of issues, which unanswered questions to answer, and so on. So we have fully empowered them. We don't want to tell them to do this or that. And that's what we told the advanced team. Because these are experienced people, and they know what to do. So we want them to be really free, empowered, and see things for themselves, and then, tell us, answers to the questions that we still have. So we wouldn't say anything now because they're not like told to say this or to do that, because they have to have a free thinking, and they have to operate with full responsibility and empowerment, and we have fully empowered them. Thank you.
Very much. DG, let's go. Shane, you had a question. Please take a mic, please. Then we go to the colleague.
Shane from China Central Television. I also have my question is also about the advanced team and the international experts. Can you share more about their backgrounds? Like which backgrounds are they targeting? Like what are their priority? Like vaccines a priority, or the transmitter is a priority? And how long they will stay in China? Will they go to Wuhan? So more questions, more backgrounds about this team will be better. Thank you.
Exactly the same answer I will give you. They will decide that as soon as they have explored everything, and where to focus, and how long it will take them, and so on. They're fully empowered, by the way, and we don't want to treat them as messengers, but experts who are fully powered to, operate based on, their expertise. Yeah, thank you.
Could we just,
no problem.
Just possibly add, because I think it's important that this mission is a joint WHO-China GORN mission. This mission brings together the best of Chinese science, Chinese public health, with the best of the world's science and public health. And we need to let those experts interact. We need to give them the space, the time to interact, to share information, to check the hypotheses of what's been happening, where this is going. So this is a moment for us to step back and let the scientists do their work. And then wait for them to give us the answers they come up with. And we have full faith in our leadership on the ground in doing that.
We saw them off yesterday, actually, last night, and that was what we told them. You're fully powered, you know, you're the experts, and we want you to tell us what the challenges are, and working very well with their, of course, counterparts in China. So that's what we told them. Our only message was to just work as experts and see what they can see and recommend what they want to recommend based on the situation they see. And I think that's what you would expect.
Thank you. We will take two more questions from here. We have 2 more questions here. We have Bloomberg, and then we will go back online. Yes, please.
Jing Hao from China Radio International. Good afternoon, Dr. Tedros. So about the Global Research and Innovation Forum, it's a good opportunity to have the experts together. So what's your expectation for this 2 days meeting? And could you mention a little bit more about the program and about the roadmap research? Thank you.
Would you like to say?
We can. The DG may follow up. He will be addressing the conference and giving the conference its marching orders tomorrow morning. But what we really need to focus on tomorrow, and this is a big gathering, and it's obviously again we recognise the tremendous work done both within the Secretariat, but with the whole series of external partners, both funding partners, scientific partners, to bring this meeting together. This is an amazing initiative to centralise our knowledge, and we need to be able to identify not only what we know, but clearly identifying the gaps. More importantly, what are the specific research priorities, and then how do we accelerate and generate the scientific information for the most needed interventions in diagnostics, medical therapeutics, vaccines, and understanding of the origin of the disease. So the outcome will be a research roadmap which clearly identifies those priorities. And identifies a framework for governing that in terms of how are those priorities going to be turned into product profiles, how are those product profiles going to be turned into products, how is that going to be financed, who is going to have access to the products that come from that process, how are we going to ensure equitable access on the basis of need to those products. So this isn't just simply a scientific discourse. There are big issues to do with how that whole process is governed, and the DG has been very clear that we need to have a broader process that defines those outcomes as well, so that the results of this process are available to all. And as you can imagine, the journey doesn't start tomorrow, it's already begun, but bringing everybody together, I think, will give us a leapfrog moment in terms of coherence, priority setting, and then setting that roadmap so we all travel that road together in the coming months. DG?
Yeah. No, thank you. Tomorrow's meeting, one thing we would expect is, again, they should be free to say whatever they think based on the unknowns we have, but we want them to focus on science. There are some people from some corners who would like to politicize it. I think we have to avoid that. We want scientists who would really focus on the problems and tell us their solutions. So this is science based on evidence, and we're expecting that experts, especially in this area, to join and help us in finding solutions to the unknowns or answers to the unknowns. And that's what I would advise, and I'll repeat it tomorrow. Science is science, and we want them to really focus on that. And politicization will not really help us. This is a common enemy. I said it many times. Let's focus on this common enemy against humanity. It attacks any human being. And that's how we should see the threat, as one humanity against a virus which we don't know very well. And we need to answer the questions in order to fight it better. And in my speech, I said there are cases now, onward transmission that are worrying us. The number of cases are very small, of course. But small cases cannot be a guarantee. Even infection starts from one. And that's why I said it could spark a bigger fire. And we need to use the window of opportunity that we have now. Because if you compare the number of cases in China and the rest of the world, in the rest of the world, I said it earlier, we don't have more than 319 cases, let's say above 300 cases. This is only a window of opportunity. And we should really work hard as one human race to fight this virus before it gets out of control. And that's my message. And the other part is, as you remember, we traveled to Beijing and we had high-level meetings and we agreed on 3 things. And one is the strategy, especially focus on the source, taking serious measures at the epicenter, at the source, that's the Hubei province. Second is sending experts so that the Chinese and international experts can work together to address the unanswered questions. And third is sharing information. But this message is not just for China, it's for the rest of the world too. We have to do all 3 in all countries, and that's how we can get better response. If there are cases reported, not only in the T24 but others, we have to make sure that to attack at the source, and we have to share experience, and they have to cooperate with WHO. If we need to send experts to other countries, they should be prepared too. So this is a message for the whole world, and a message that this is a common enemy that we can only defeat if we do it in unison and in unity. Thank you.
Thank you very much, Dr. Tedros. We have really time for only 3 more questions. We go to Bloomberg first, and I will go with 2 questions online. Thank you.
Thanks for squeezing in my question. It's Hugo Miller, Bloomberg News. There was a study out that concluded January 29th that was published today in China. It's from a pulmonary disease specialist. I think his name is Zhong Nanzhan, forgive my pronunciation. But he said that he concluded that the incubation period, which I think we've typically understood to be up to 14 days, could easily be as long as 24 days. So the question I have for you is whether that, having absorbed that, whether you're considering changing your recommendations on quarantine periods, be it on a cruise ship, be it wherever around the world, by up to another further 10 days. Thank you.
At this point, we take all observations obviously very seriously, but there are many, many different observations of length of incubation. And an incubation periods at either end of the spectrum we need to look at very carefully. A very long incubation period can reflect a double exposure. We take exposure as a proxy for infection. So we assume this exposure led to the infection. We've seen this in Ebola, when we've seen very long incubation periods, and then when we investigate, we find, oh no, there was a second exposure a week later or 2 weeks later, and that's when the actual infection occurred. So there very often can be outliers, and they can be because of the recording of the exposure. So we need to be really, really careful when we look at outlier figures. The median incubation period in that study is actually 5 days. And the 24 days is an outlying observation. So the study doesn't conclude that the incubation period is 24 days. The study concludes that the median is 5, but that the outlying observation is 24, and that needs to be taken seriously. But that needs to be taken in the context of all of the other studies. So at this point, WHO is not considering changing anything, but we will consult further and more widely as we always do. Sylvie, I don't know.
We will have 2 questions from colleagues online. We start with Sarah Bosley from Guardian. Sarah, can you hear us? Hello, do we have Sarah?
Hello?
Yes. Hello, can you hear us? Maybe we can go to...
Hello?
Yes. Sarah, can you hear us? We can hear you.
Hello?
Yes.
I don't think she can hear you, Terry.
Chris, maybe we can go to try to get another journalist online from DPA, from German agency. Do we have anyone online? Kai is online? Well, okay, we'll take then Kai Kupferschmidt. Kai, can you hear us?
Yes, I can. Thanks for squeezing in my question, Tarek. I just wanted to ask a question about the case definition. So there are reports that the Chinese National Health Commission has changed those, and that basically people who test positive for the virus but have no symptoms will no longer be counted as confirmed cases. Is that partly what's behind the lower numbers we've seen? Do you know anything about this?
Kai, truthfully, no, we're not aware of that change. We will check it out, obviously, but no, we're not aware of any significant change to the case definition. Certainly not one that discounts lab-confirmed cases if they're not some. No, we'll have to check that out and come back to you. It sounds strange.
Okay, well, thanks for that. We will conclude with this, and sorry for all those whose questions have not been answered, but as you know, we have this daily press briefing, so hopefully we will take those questions too. Again, just to remind you that audio file will be available immediately after, and transcript hopefully will be posted early in the morning. Thank you, Dr. Tedros. Thank you, Dr. Ryan. Thank you, Dr. Brian. And thanks, everyone, for watching us. Have a nice day.
Okay, thank you. Thank you, and see you tomorrow.